up so many of our citizens for low-level offenses, and that access to mental health and drug treatment, education, jobs, and housing can help create safer communities today and in the long term. This year, Team Seattle is working with the Seattle Police Department to give patrol officers the tools and information they need to de-escalate interactions with people experiencing a mental health crisis and divert those individuals to services instead of arresting them. The Seattle Police Department has made great progress moving their department past a history of excessive use of force, and spreading new models for interaction with mentally ill individuals will be key to the ultimate success of that effort. The Salt Lake County team is working with the Salt Lake County Mayor's Office and County Criminal Justice Services Agency to help people succeed on probation and avoid rearrest by making it easier for case managers and clients to communicate with each other. Nationally, about 30 to 40% of individuals in local jails are there for a violation of probation or pretrial supervision. Sometimes something as avoidable as missing a court hearing or losing touch with their probation officer is the cause for this violation. And early results show that Team Salt Lake County's tool has already saved hundreds of hours of staff and client time and directly helped some of its first users avoid a jail stay. So tonight, first we'll be hearing from Team Seattle, and they'll be followed by Team Salt Lake County.
Hi everyone. So tonight we're going to talk a little bit about our work with the Seattle Police Department. This is our team. I'm Meredith. This is Catherine. This is Grayson. Wade. So to set some context, Biz has a mental illness, and he's already interacted with the Seattle Police Department 65 times a year for causing public disturbances in downtown Seattle. The police almost always send him to the hospital, but he barely meets the hospital's criteria for being admitted. So he's out within a couple hours and hasn't received the care that he needs. The police don't know this, so the next time they see him, they're going to try to do the same thing again. So the Seattle Police Department receives thousands of calls like this every year. So if the officer finds that the main cause of the call was that it was a mental health crisis, they categorize it as a crisis call. More specifically, last year they received 9,675 crisis calls. There's a special police unit called the Crisis Response Unit that responded to 300 of the most recent cases as follow-up, and then for 40 people, they wrote tailored response plans because they were having frequent mental health crises. So, 42 may not sound like a large number, but actually when you think about dozens of people like this can create a really large impact. So creating a tailored response plan for him means he doesn't have to interact with police on a daily basis anymore, and he can be in a more stable situation. From a police perspective, now they have more time to be helping more people. So the response plans currently look like this. So the crisis response unit works with caseworkers, they talk to the person, and then they look at incident history to understand what are some tailored actionable steps that patrol officers can do when they're interacting with the person. So this is a lot of useful information, so what's the problem? Well, the response plans are hard to find. As you can see here, it's pretty hard to pull out the key information, and then once they're sent out, they can't be edited. So when the officer arrives on the scene, they actually probably don't have that much context for the person that they're talking to. So what we're doing is we're making a responsive mobile application that's going to be available in the patrol cars, on the computers, and also on the SPD smartphones. Since most of the officers don't actually have smartphones yet, they're relying on the car computers, which means we have to design really well for cars. Part of that is also making sure it's connected to the 911 system, so when officers are responding to a call, it's just one tap and it pulls up the response plan. Now we will dive into the world of live demos.
Brave.
Oh no. So I thought. Okay, well that's unfortunate. So come see us afterward, we'll walk you through a live demo, it'll be great. But so the main thing is that when police officers are arriving on the scene, they have two main questions. The first is, what should I know? What am I walking into? And then what can I do to resolve the situation? So what you will be dazzled by when you come talk to us afterward is a plan they pull up, and it's going to offer information like images that they can swipe through, as well as officer safety information, so they know Biff gets agitated when he's touched, so avoid that. It takes the block of text and moves it to large, easily scannable steps, and then has background information like where he's frequently encountered, general context, and then visualization so they can see, based on previous incidents, has he been seeing the police more frequently in the past few weeks, and also what works well for him. So if talking to the case manager was good for him, seems like a good place to start.